and I'm now very happy to introduce Nazarbayev University's own head of the public health program, Dr. Byron Crape, who has done various things in various places and studied physics and engineering before settling on public health and travelling with the WHO and then a series of other organisations around the entire world, it seems, biography, before finally coming to Kazakhstan to help the very, very new School of Medicine with their public health program. And Dr. Crape will then tell you more about his research and his thoughts on the current practice of vaccination and the problems thereof. So here is technology, here is water.
Thank you very much. I probably need some water here because it's been a long day, a long life, and a busy day today. I'm going to be talking about the anti-vax movement. The anti-vax movement is the anti-vaccine movement that has historical roots, and we'll even touch on a little bit of what's happened in the richer countries and how that's influencing the poor countries as well as the medium-income countries, such as Kazakhstan. So my title is Anti-Vax Movement and the Challenge for Primary Care Professionals. And I'm going to talk a little bit also about the failure of the richer countries in controlling the anti-vax movement that has allowed it to move into many other countries through the internet. And we're going to look at a very brief look at that history as well as what's happening in the near future. So why does the anti-vax movement need to be addressed? It's a big question because it appears at first that we can just ignore it. We've ignored it in the richer countries for many, many decades. It's actually started mostly primarily in the richer countries, but spread to many other countries, but it's maintained itself at a very low level. So why is it important? Well, first, before we start looking at the anti-vax movement, let's just look at a very, very brief summary of the success of the vaccine movement, the pro-vaccine movement. First, I just want to talk about the safety of vaccines. There have been mistakes made. There have been some manufacturing problems. There are some efficacy problems for some vaccines. But in general, the risk of anaphylaxis, which is the most severe form of allergic reaction, is really rare. There are allergic reactions, but they're usually very mild. So somebody who's vaccinated, especially a child, usually the reactions are very, very mild. But overall, for all vaccines, it's estimated to be only 1.3 reactions of severe allergic reaction per million vaccine doses. And none of those people were registered as dying because there was immediate medical and health care support following it. So it's reasonably, even though there are some risks, it's reasonably safe, very safe, in comparison to not having a vaccine, and we'll be looking at that issue in a moment. The number of lives saved, estimated by the World Health Organization, is that there are over measles vaccination alone saved over 17.1 million lives since 2000 to 2015. That's now over 20,000 people. So vaccines have actually effectively saved many millions of lives from the advent of when Jenner was starting his cowpox vaccination for the protection of smallpox. In 1999, vaccine-preventable diseases among children were at an all-time low. It's based on the Center for Disease Control. But unfortunately, there's been a number of gains in the anti-vax movement. Now, the anti-vax movement, again, has been with us for a few centuries. And we'll look a little bit at the history in a moment. But the anti-vax movement is blamed for reductions in vaccine coverage worldwide, leading to preventable diseases, outbreaks, and deaths. And I think there was a mention already of the measles outbreak in Europe. As of 2018, in the first 6 months, we have a record based on WHO data of 41,000 measles cases, the highest in a decade, with 37 children who died in the first 6 months this year. And in part, people feel, many of the experts feel, that that was due to the anti-vax movement, so many children were not vaccinated. In Quebec, Canada, there was a measles outbreak of 776 reported cases in 2011. 80% of those children were not fully vaccinated. A pertussis incidence was 10 to 100 times greater, where the immunization for that disease was disrupted by anti-vax movements in the countries of Sweden, Japan, UK, Russian Federation, Ireland, Italy, West Germany, and Australia, as compared to where I think I've got the wrong PowerPoint. The corrected one. I'm going to make one little correction. Sorry, folks. This was not